Good afternoon, friends. David Wright here, and I'm your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am joined by my friend Maria Sexton. Maria, it's an absolute pleasure to have you on. Thank you for being here.
Thank you, David. I'm happy to be here.
Absolutely. It's a family affair. We've had your husband on, we have you on. Maria, for those of our listeners who may not be familiar, do you mind just sharing a few minutes about your current role?
Of course. And yeah, we like to say we're a 2 CIO household. So yeah, we get a little laugh out of that. So I am the Senior Vice President and Chief Information Officer for UT Medical, which we do business as the University of Tennessee Medical Center, based here in beautiful Knoxville, Tennessee. As the name implies, we are affiliated with the University of Tennessee. Back in 1999, we actually separated officially from the academic side from the university, but have a very close affiliation with University of Tennessee. And in the role that I have now, I oversee all technology service delivery for our institution. And sometimes people get a little bit confused as to who we are because of the name. We are a healthcare system. We are also an academic medical center, which means that we have two important missions. We are delivering healthcare every day to the patients and those we serve, but also we are a teaching institution, which means that we have residents and fellows and nursing students, pharmacy students, all of that coming through our organization. So it's, again, I like to say we've got two important missions here, but not a university, a health system.
For sure. Yeah, no, it's an honor to have you, and I've been looking
Thank
forward to
you.
this. Maria, we like to start every episode with if there was only one, because I'm sure there will be multiple, but if there was only one piece of actionable advice you might look to leave everyone with today, what might that
Mhm.
be?
Well, I'm always ready with that one. It's a little slogan I've come up with for myself is stop saying IT in the business. It's only the business.
That's a
That's a
mic drop
t-shirt.
one.
Yeah, but
I
that's a
love it.
t-shirt. Yep. Mm-hmm.
Well, I'm sure we're gonna get more into that
Sure.
over the course of this podcast, so I'm excited for that. Um, Maria, I want to, but I'm excited to talk about UT Medical Center and get into what you guys are up to.
Yeah.
Before that, I want to learn a little bit more about you as an executive, kind of how you started out and how you got to the point that you're at in your career today.
Sure. So I've been in IT and cybersecurity, and I'll kind of elaborate on that on both of those disciplines, if you will, or in both of those disciplines for 30 years. So I started, I like to say, when the internet came into being. We both landed in technology at the same time in 1996. And really, I mean, it's not a great origin story. It really was that at that time in 96, I was working as a secretary, right? And back in the day, that's what they called them, right? They weren't fancy titles like admin assistants and stuff. So I was working as a secretary at the American Medical Association in Chicago, and really kind of came to a realization that I needed something more lucrative, a better career, 3 children, and something to do. And I say this jokingly. I mean, it feels like such a long time ago. When I was in high school, I took a computer class. You're going to see a cat on my finger. I like this little cat finger puppet thing. I was in this sort of a learning program in school, and we went to do computers. The computers were a keyboard where you put punch cards in. Okay. That's literally what I did. The first program I ever wrote, it printed out on green bar paper, Van Halen, because I love classic rock, said Van Halen. That's what my first typing punch cards. Anyway, fast forward into what am I going to do with my life? Hey, why don't I go into IT? Right? I did that when I was in high school with those punch cards. So I went to talk to the network administrators who were part of the AMA at that time, and they said, well, Maria, you have zero experience beyond that punch card incident with Van Halen. So you're probably going to need to go to some sort of training. And so anyway, I took a loan out and went to school right in Chicago. So I worked during the day, went to school at night, and I learned about networking. Took 7 classes, passed 7 tests, and at the end of it, I was a certified netware engineer, CNE. And I'm like, this is great. And I was talking to the director of IT at the time at the AMA, and I said, please give me a chance. Please give me a chance. And she finally was like, fine, and put me on the help desk, which was awesome. Still my favorite job of all the jobs I've had in IT. But somebody said to me, golly, Maria, why'd you get a network certification? Everybody's moving to Microsoft. And I thought, that'd have been good information to know 6 months and $7,000 ago. No big, no big. I went back to that school, took another $7,000 loan, and went to the Microsoft certification program. So now within a year, I'm a
That was
CNE.
an MCSE. Yeah.
And you got it. And at the end of the year, I was a CNE, MCSE, right? Totally paper. But anyway, I had to put the learning in because I didn't have the experience. But I obviously had an aptitude for technology. So tests and stuff. It's a lot to learn. And I started on the help desk. And as I said, it was my favorite job in IT because I really honed my skills and in that job of solving problems over the phone and at the work site, if you will. I love the customer service part of technology. I'm really not a tech geek, which, is a little bit different than Brad, my husband, who's he's a bleeding edge tech person. So anyway, fast forward through different career opportunities and that early on in my career, I sort of identified that I was never going to be a great engineer. My mind doesn't work that way. But what I did pick up on was that I had some fairly decent leadership skills. So early in my career, I had decided two things. One, I'm good at operations, and I was probably never going to be a great engineer, and so I was going to lean more into maybe leadership opportunities. And two, I had early exposure to information security, right? When I was one of my jobs, I came in, and the person that was doing security at the time said, hey, I need somebody to help me with security. And this was security back in the day when we were updating antivirus files and doing some firewall stuff, not security like it is today. Anyway, I raised my hand because what did I know? That was 1998. And so I would say those two decisions, the decision to go into cyber and the decision to recognize I wasn't great at the pure tech part, but I was pretty good at operations and pretty good at leadership, led me to start focusing more on opportunities to move into that. And just over the course of 30 years, keeping one foot in kind of traditional IT and one foot in cyber has kind of led me to opportunities. This is my second opportunity as a CIO, but really kind of kept me really plugged into both of those as security developed its own specialty and subspecialties, but also IT. And then I continue to develop the leadership skills. So it was, again, I wanted to keep it succinct, but over a 30-year journey into that. But again, I credit the recognizing my strengths and the areas that I wasn't going to excel at.
No, that makes sense. Yeah, I just, when I was in high school, I studied MCSE. I thought I was going to go to RPI, and I like went in a different direction for a little while, but you took me back there for a second. And I do have to ask about the finger puppet, because I love it. And like, I could tell you what it signifies for me, but I'm curious now where that comes from.
It's two things. I'm a huge cat lover. I've got a cat, mouse pad and a cat calendar and a cat at home. And at one point in my life, mine and Brad's lives, we had 10 cats. I was that proverbial, cat lady that we talk about. The cat puppet, I have a lot of energy. I need to almost intentionally sometimes slow the speed at which I speak and walk and all that. And so the cat puppet for me gives me something to sort of do. I don't know. It makes me focus. I think it's more of a focus type thing. So it's not a stress ball. I'm looking around. I don't have a stress ball in my office. I just like to think about it. It makes me laugh. It's a little bit lighthearted. Don't take my too seriously. It's all those things. Yeah.
That's where I went,
Yeah.
which is something that I've gotten the opportunity to get better at, which is not taking myself too seriously,
Wow.
being authentic to who I
Mhm.
am. And I love the intentionality of something like that, right? As a reminder, because with myself, if I'm going to speak, if I'm coaching my team, slowing down. I'm from New York, right? Funny story, quick, and then we'll get back to it. But I was like in Texas. I was in Texas, like in Dallas, like a week ago, and I'm like walking through the hotel lobby, and out the main entrance, and there's like this like group of like 3 or 4 people, and I was dressed in streetwear. 'Cause like when I'm not at working, I'm like wearing like hoodie and stuff like that. And they were afraid. They were like, because I was just walking by them, but I was walking so fast,
Right.
and the guy like kind of like back, and I was like, "Oh my God, I'm so sorry." He's like, "Yeah, dude, I thought you were like coming at us." And I was like, "No, no, this is how I walk." It's like,
I love that. I love that. I'm from Chicago. Same. I only have one speed. People are like, slow down. I'm like, I can't. Even when people have said, you talk too fast. And I'm like, you listen too slow. Like, you just gonna have to figure out how to meet in the middle here somewhere, right? Yeah. So I get it. I get it. I'm a fast peddler.
yeah,
I've been accused of that, but I do only have one pedal speed.
like, um, so I no, it was really helpful to hear more about your kind of origin story, Marie, and like, I thought it was really interesting how you said like the help desk position was one of your favorite jobs. Um, Over the course of your journey, kind of, up the CIO ladder, so to speak, what would you say was one of the most important lessons for you? Like, what was one of the most important things that you learned, either in those early days or just anywhere along that journey?
I'll tell you, I thought about this one too, and this applies both personally and professionally, and I think it has helped, is to get rid of the clutter. And I say the clutter very intentionally too, whether it is the clutter of your work, the clutter of your home decor, the clutter of your relationships, the clutter of your friend group. It's just everything around that word. It's simplification. And it's helped in the career too, because, I'm early on in my career. It's 1996. Again, and I'm not making this a gender thing. So hear me, because I don't like to do the women and I recognize I'm a woman in IT and I support, I'm not saying that, but just the challenges of being in an industry where you might be seen as a little bit of a unique animal. Um, and so you kind of start gobbing a bunch of stuff and getting involved in a lot of things and taking a lot on, and you're sort of filling your life professionally and personally with a lot. And so I would say that that was a lesson of simplification, really, again, honing in on the what do you do well? Where can you add value? What adds value to you? And clearing those things. And I say it now that at my age and in how long I've been doing this in my career, but just in my life with children and grandchildren and a husband and all of that. It's just getting rid of the clutter, clearing your mind and being, again, very intentional, very thoughtful, very quick focused. A book I'm listening to right now is about, clarity is kindness, right? Being clear is kindness, but clarity in your life is kindness to yourself. So
Yeah,
professionally or personally.
yeah. No, I love that. It's funny how I had a couple weeks ago, I had a colleague come in, and we had some younger guys in the New York office, right? And sometimes they can like leave like bottles of like seltzer like on their desks and just like leave for the day, or like there's a bottle of iced tea that's in the office over there. It's just been sitting there. I'm like, what is it, like fermenting or something? Like, and another colleague of mine came a couple weeks ago, and I don't have time to clean up all this shit. Nor is it really my responsibility. But I also haven't voiced like a real like, and I don't really think I should have to. But anyway, I digress. She helped me clean up, and like we vacuumed and like really like, and it was amazing uh how great that is. Like you're saying, to just have that space for
Mhm.
me to be able to think more clearly, and so that really resonates with me, and it's something that it's a great reminder, um,
Mhm.
to get rid of the clutter. What about things that you've had to overcome? Like, for me, I would say that the most profound shifts in perspective that I've had, or moments of growth, have come out of times where I either had something fail, or it was a personal kind of like moment. Is there a time that sticks out in your journey that like you were down or you had something fail or something of that nature, but you ultimately took away something that that still serves you today?
That is an interesting question. Recently, so here at UT Medical, we have a great program called the Healthcare Leadership Academy, and it's a cohort of individuals, right, up and comers, if you will, high pots, high potential, kind of moving forward. And we had a cohort last year, and I was asked to give the commencement, which I thought was really wonderful because I hadn't been with the organization very long, so I thought, great privilege and honor. But I thought long and hard about these are leaders, and I'm here to, what am I going to come in with my real, leadership pep talk, and what's Maria going to impart after 30 years? But what I talked about were 4 instances in my professional life where I really messed up because it was about vulnerability and it was about sharing that there's a persona we bring to work. There's a persona I bring as a member of the executive leadership team, and it's the jacket, and it's the good hair, and it's the pin, and it's all the things, right? But there's a person obviously behind that, and the journey through leadership, right? You've raised your hand to be a leader, especially a people leader. You better recognize there's a tremendous obligation in that, right? I shared with that group. People talk about us, our team members, around their dinner table. And if that doesn't hit you right in the stomach on what the responsibility and accountability is as a leader, I don't know what does. Right? These are people that go home and with their loved ones say, my boss did this, my boss, good or bad. That's the impact we have in their lives. So I say that to say in that, I don't want to, we may not have to get into all those specific stories, but what I shared was throughout my 30-year journey, these instances where I really did mess up. I messed up with my relationship with a team member in the sense that I led in an ineffective way, I should say. It wasn't like I broke technology. Gosh darn, if you've been in that technology any amount of time, you're going to break shit. That's not it. It's the where I messed up with people, where I didn't, I took myself in a way too seriously, I thought I was all that, and just stuff like that. So anyway, in that commencement, I talked about these 4 situations and how they kind of broke me. And almost as I got further in my career and thought I really had it figured out, those instances broke me even harder. And I had to learn, right? I had to come back even more because I really thought I'd had it figured out at that point. And this was something that happened a couple of years ago, and it was not an intentional thing, but I had just said something that in a group all hands meeting that offended some people. I didn't see it as an offensive thing, but I did. And when I was told about it, I immediately was so ashamed and I apologized, but it kind of wrecked me a little bit. So I just think, again, it's that vulnerability, it's that constant learning. It's just all of that we, but I center it around the leadership role and the fact that we lead and work with people. Technology, let's face it, technology is easy. It's the people leadership part that's hard in this job, not the tech.
It resonates with me, what you're saying. And I really, really appreciate when leaders can show up with a level of vulnerability that breeds human connection and makes really fantastic leaders, in my opinion, versus people that are just in leadership positions that manage people, right? Because it's very easy for me to tell someone what to do and for them to do it or not, and for them to go home and be like, this sucks, right? Like, but
Right.
to touch, move, and inspire people. And I mean, there's a couple of things that come to mind. Like a few months ago, I was talking with Walt Carter. He's a buddy of mine, CIO, author, and we were talking about the failure of digital transformation initiatives that like outfits like McKinsey and this one and that one have reported on for the last 20 years, right? No matter what type of digital transformation, the failure rates are still to this day astronomical. Like, 70-80% of these initiatives across all industries have a tendency to fail. And if you look at the failure, more often than not, it goes back to communication and organizational change management and all things that are tied to the people, right? Like, and the way that we inspire, communicate, etc. Enrolled, and he was tying it back to a study he had read on, um, and I'll have to put these in the notes to the comments, but about like disenfranchised employees and the fact that like more often than not, 70% of employees feel disenfranchised from what their executive team is doing, right? So,
Mhm.
like, they're just like, they're over there doing this, I'm over here doing this, and, like, I don't know what the hell they're doing, but, like,
Right.
whatever, I'm just
Right.
gonna show up and do my thing. And when we're talking about large-scale enterprise digital transformation that involves all of those people
Mhm.
consuming and leveraging the technology, and they feel disenfranchised and disconnected from what we're doing over here, of course you're setting yourself up to fail, right? So I think what like and one of the in my experience, the best ways to like kind of humanize myself in a leadership role is to show up as a fucking human, right? And
Right.
be like,
Right.
yes, you have to wear the suit. Yes, you have to exude confidence. Like you have to be a leader, right? Of course.
Mhm.
But that doesn't discount being able to show up and like when you can create that identification where I can say, "Oh wow, Maria, she failed once." Like, "Oh, I failed too." Like, it breeds connection and identification, and I think then people want to follow you.
Right. Right. I
So
agree.
I love that.
I agree. There's some of the feedback I got after that commencement were a couple things. One, it was something they did not expect to hear, but also two, in that same vein, they were happy to hear it because again, I think it's part of what we talked about, not taking yourself too seriously. Take the work seriously. It's important in what we do, but not ourselves, but to show ourselves again as humans first. I say that all the time. Our team members are humans first and employees second. Right. And so really understanding that doesn't mean over rotating and all of a sudden we're all bleeding hearts and all. It is a job. We do come to job, but understanding that people have a lot and understanding more about them and what who they are, and as much as they let us into their lives. And that's again what was some of the early problems, early, puddles of shit that I stepped in the beginning of leadership that I eventually, kind of realized that. But that's because I think back then too, there really wasn't a lot of literature around leading that way, right? These are more current sort of ideals about empathy and leading with that, humanity and servant leadership and what the role of a leader means, right? It's
Right.
not just, well, you were good at network engineering, so you should be our next CIO. The tech
Right.
skills are important, but there's tremendous skill and ability and things to learn in being a leader constantly, right?
And I think now more than ever,
Mhm.
the the leaders in this IT and digital world need to embody this skill set, right? Like it
Right.
can't just be someone who came up on that track, knows tech, and then like is trying to reach across the aisle. It's just not it. It's
Right,
just
it's
not
not.
gonna do it.
Mm-mm. Yeah.
Especially if we're talking about AI readiness and like the democratization of these technologies such that like, you know, students, researchers. I mean, like for different institutions, the the scale of it is just it could very easily get away from someone that isn't really plugged in. You know,
Right. Right, that's very true.
Uh, um, it's very interesting stuff. So thank you for sharing that, Maria. I wanna talk more about your current role. Uh,
Sure.
Before we do, I always just like to ask favorite book, or literary piece, either like one of your all-time favorites or something you've read recently, your
Sure.
choice.
Sure. I used to be a real avid reader when I was younger, but, having kids and doing all that stuff, I kind of got away from that. So recently I started doing audiobooks. And I
I
thought,
love it.
yeah, I love to read, but it's easier just now to listen to them. So I listen to multiple books at the same time for different reasons. So I'll tell you what I'm doing right now. So I am listening to the Brene Brown Dare to Lead book.
Yes.
And that topic. So I love that, right? That's what I was talking about. The clarity is kindness or being clear. Some really good things there because I am again on a constant journey of being a better leader and a better partner in the organization. But my part that I read for pure enjoyment, I love to read about sort of old English kings, monarchs. I was born in England. I've been in the US for a very long time, but I have this real thing about it. And I'm a British citizen, so I really like to learn about that. And Alison Weir is an author who writes lots of books about, again, monarchs of the, 15th, 16th century. And so there's a great book on King Henry VIII and King Henry and his 6 wives. And then she's written books on each of those wives. I love to listen to it because it's just like I'm intrigued by women of that time and how they interacted with very strong men, right? And just that, but they're very, they're both interesting from the historical perspective, but also interesting from the human perspective. So I'm always listening to multiple books. So I'd say the most recent ones I've listened to are Alison Weir and all of her series of books, and King Henry VIII and his 6 wives, and then the Brene Brown.
Love that. So behind my desk, I have Teddy Roosevelt "Man in the Arena" quote that she's
Yes.
big on.
I love that.
There had ended up being some controversy about Teddy Roosevelt and all that, whatever. But like, I mean, that quote, oh my God, like I read that, and as a leader and entrepreneur, like, so it has made me tear up before, because just like, like there's sometimes in those moments where you're just like up against it. I'm a sap sometimes. Like sometimes I'll cry on Shark Tank just because, but it's because I identify with like these like stuff people have gone through to get to where they've.
I'm a Maxwell House commercial crier. That's what I do. Always the Maxwell House commercials at Christmas, right? Where the kids coming home from college or the military members coming home. It's always, the coffee, they're making coffee late at night. So yeah, I'm a crier as well, but I mean, it is what it is. We started this. You can be many things at the same time.
Exactly. Yeah, very cool. And Brene Brown is like, yeah, she's one of my favorites. I hope to have her on the podcast one of these days. So shout out to Brene Brown. So UT Medical Center. So you've been there over a year now. How long?
You know what? Next Tuesday will be a year.
Wow, that's awesome. So talk to me. So as we know, as IT executives, you've been drinking through the proverbial fire hose here, which can often take a year in and of itself. Talk to me about your vision, given this kind of multifaceted mission that we talked about at the onset of the episode, and maybe some of the key things that you're focused on right now.
Okay. So I'll kind of preface a little bit with, again, having done this for a very long time, I've worked in a lot of different industries, consumer packaged goods with Kellogg's, retail pharmacy with Walgreens, the Department of Energy on the federal side, healthcare in a number of different iterations, spent time as an auditor with Deloitte. So I've worked in a lot of different industries. Healthcare, I think, again, that's going into that and that intentionality about going into healthcare IT. The work is hard, and it's hard everywhere. I've not met an industry or a company that's flush with cash and able to do everything they want to do. Challenges are typical wherever you go. What I like about healthcare IT is that it's there's a mission behind it, right? There's a very small degree of separation between what I do and the patients we serve. That's important to me. Doesn't make me, special. It doesn't make me, oh my gosh, kiss the ring or anything. But that's important to me, the knowing who we serve. And so, again, I've been in healthcare IT for some time now. The role I had prior to coming here was a similar organization in Las Vegas. And I've been in East Tennessee and here at UT Medical for a year. And Brad and I had discovered Knoxville about 20 years ago when both of us worked for the Department of Energy. And we came to Knoxville because we were doing some stuff with the national lab out here, Oak Ridge National Lab. We worked on the classified side. Anyway, we learned about Knoxville, and then 20 some years later, there's an opportunity that comes up here at UT Medical. And so I was a little bit torn about it. And it's not for any reason about leaving my old organization, but we have 6 children. 4 of them, they're all adults. 4 live in Las Vegas. But more importantly, we have 7 grandchildren. 6 of them live in Las Vegas. So it was a tough
Right.
decision to move. The reason why I believe all of this happened at the same time was the youngest one in Las Vegas is 3. And I had, I
Oh,
think, enough of a relationship with him that I wouldn't have to reintroduce myself to my grandson every time I visited Las Vegas. Our other 3-year-old granddaughter lives outside of New York. So anyway, so boom, okay, this is the right time for me to strike. I come and do the interview. It all works out. They pick me, and I come here. But interesting, I'm not from this area. Clearly, you can tell I don't have that charming Southern accent that they do here. But I'm also just an outsider in the organization. This organization has been around for a long time, very relationship driven, long tenure. So I have a lot, not stacked against me, but things that I sort of need to contend with. Anyway, I get here and talk fast, walk fast, just fast, fast, fast. And there are incredibly bright people here. But I'm coming in sort of, I don't know, looking to disrupt things, to change things. And so some of the challenges have been not necessarily slowing down, because then I would not be my authentic self, but figuring out how I can use that to help the organization move forward. I'll tell you one thing. I was struggling in the beginning because I was wanting to go faster and felt the organization was slowing me down. And I reached out to a chief people officer for another organization here in town and talked to him about this. And you know what he said? He said, Maria, there's nothing wrong with going fast. Just make sure that you're bringing the people along. You're not building a chasm between the two of you. You're moving fast, but you're bringing them with you. When he just said that about sort of epiphanies, I hadn't thought about it that way. So where I was thinking that I was moving fast, I was potentially building a gap rather than making sure that I was running and I was pulling them too in a very professional and collaborative way. So, the role here, we are a big organization. We have clinics and we've got an outpatient setting and we're a big hospital. We have a very, very well-respected brand in UT and UT Medical. And so coming in, but we've grown quickly. And so I think, some of the challenges that we're dealing with too is just we got the tech debt everybody else has, and we've got some immature processes and some things like that. So I come in, and in this first year, I have listened in as much as I can, because that's one of my weaknesses is, not listening with intention. I'm always ready to jump in. And so trying to do that, but also appreciating who we are as an organization, as a culture. We just most recently won our Forbes Award for #1 culture in the country, not in East Tennessee, not in healthcare, in the country. So we have a great culture, but it is about embracing the culture and who we are, but still moving quickly, because healthcare is very competitive. And
right.
so I'm trying to get, our technology up to where it needs to be. I am building those relationships. I'm building credibility as, again, an outsider to the organization and an outsider to this area of the country. And it's funny that you talked about the 1 year. Another book that I read was that first 90 days. At an executive leadership level, as a senior vice president, you don't get a year. You don't get half a year, right? You have to start contributing as much as you're consuming. I don't know that you get 90 days. And that is not a fault of this organization. It is a recognition of the role, right? You don't come into it lightly, and you better you better hit the ground running. I don't know, like day 6, maybe.
Yeah.
So
Yeah.
I
Well,
don't
I
know
mean,
yeah.
even,
Oh, go ahead.
even, no, I was going to say, like, even, I mean, my coach used to tell me, like, you can't hire on potential, right? So, like, I mean,
Yeah.
even non-executive roles, I expect the person to come in and contribute, right? They're going to take time to learn certain things and to do things better, but like, I need them, you know,
Yeah.
so I think that makes sense. It is more complex in that role just because there's so much more to digest, but,
But truly, right? The runway is shorter because, you come in again thinking you're all that. You got this 30-year resume behind you of how you essentially have earned this role. Okay. So
right.
you're managing that. So then it's kind of, okay, well, you got here. Let's see what you got. Again, it's people, there's a lot of grace, and people will give you time to learn the organization, not to learn the job. You better have come to the job knowing the job, but to learn the organization, and you had better do it quickly and sort of self-sufficiently. right? In that
Yeah.
sense, jump in, ask questions in that way. So it's been a great year already. I feel like again we're making some changes. We're moving the organization forward. I was going to say that I respect who we are and how we've come up, but I'm not beholden to it. You know what I mean? Right? We've got to look forward
Right.
while
And
reflecting and appreciating where we come from.
for sure. And I mean, I love what you said about competition too. I mean, Tennessee is like the hotbed of healthcare, right? So it's like you're like in the
We're in it.
mecca,
Yeah.
or at least one of them.
Yes.
And I also really, what you said about kind of going fast and like not creating that chasm, like it reminded me of a piece of feedback that I got from a CIO early on in my healthcare, IT consulting days. I came in and I had all these ideas and I had done the assessment and I was like, listen, you guys have like all these opportunities like many health systems do, right? Just
Right.
because of all these different reasons, M&A because we're trying to keep up with payer constraints and like all the like macro kind of things that have caused health systems to grow the way they have. Typically
Mhm.
they have tech debt, they have opportunities. Anyway,
Sure.
I come in preaching all these like ideas and like, oh, you got to do this operationally. Like we're going to look at this technology, da, 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 da. And, uh, and then ultimately there was an incumbent person that was just like, oh, no, we have to save money. We're just going to move this to this. And like, ultimately, like they took my work and they're like, this is great, David. Like, thank you so much for this. And like, we're good. And they turn to their incumbent. They're like, yes, save $1 million. How do we do that? And they're like, oh, you just go there to there. And like the feedback that I ultimately ended up getting from the CIO was that I didn't meet them where they were at.
Mm.
And it was like one of the best pieces of feedback that I've ever gotten. As difficult as it was and they loved the work. It was just like I was like overcomplicating it and I was running and I wasn't taking them with me. Like
Mhm.
I wasn't taking the time to backtrack a few steps and really like get there because if I wanted to go fast, there's actually a concept Gene Kidd talks about in his book Wiring the Winning Organization called slowification. And it's like basically just like slow down to speed up, right? Like sometimes you need
Yes.
to do that.
Yes.
Mm,
Slow down to go fast. Exactly. I've said that a few times here. How we've got to slow down so that we can go faster.
right.
Mm.
Um, what about challenges that you guys are facing as an organization? I imagine some of the same kind of you know constraints that other particularly academic health systems are facing. But
Yeah.
what have you been handed in this role, kind of from
Sure.
a
I'd say, David, probably nothing that, your other folks that you've talked to on this show haven't already shared. I mean, it's the same, right? Again, it's the aging technology that we need to invest in. Again, there is a lot of innovative technology out there, especially in the healthcare space. And, we'll talk, or maybe we won't, but if we think about AI technologies too, I think for no other industry does AI hold more promise, right? Because minutes matter in healthcare, and anything we can do to cull through globs of data to figure out what's going on with a patient and change that outcome is important. So say those are some of the challenges, but also probably the biggest challenge. It's not a challenge. I hate the biggest opportunity that I feel that I have here, and I've started to do some things in that space is recasting or restating IT's role in the organization, this specific organization, through whatever ways that we have gotten here. What I have found is somewhat of a decentralization of IT. And see, I'm not really about that. Just like every department and division has a role here, nursing and pharmacy and, our environmental services and food nutrition, so does IT. And I'm not about, abdicating that role. We have an important role in the organization. We are not more important than any other division or department, but we are as important. But it's almost like I have found, and this is not just here, it just tends to happen over time. What I call it is sanctioned shadow IT. We have created an environment where we have sort of forced the customer, I don't call them users, the customers, to have to create their own IT. And so when I come here, I have a fantastic team of people through time and culture and different leaders and all that. We've sort of watered down, if you will, diluted our contribution to the organization. So I'm gathering those things back, right? And saying, listen, you already have a huge job of running the pharmacy. We have an inpatient pharmacy and a retail pharmacy. You have a huge job of running surgical services. Why don't you do those things and not worry about running your IT? That's what we're here for. It's a partnership. And I'll tell you that no leader in this organization has said, no, Maria, I would like to run pharmacy and worry about the server operating system I'm running and that I need to upgrade it, right? It's
Right.
that kind of a thing. And so I say the challenges, the opportunities are so easy to resolve. Again, these are not insurmountable. Never have enough money, never have enough people. We'll always be behind our adversaries on the cyber side. And it's not a defeatist attitude. It's just a realist, right? That's who we are. It's the industry. But the thing we can fix is our role in the organization, how we show up every day, how we partner, and that we're always, again, considering IT as we're on the same level. That's why I started this with, it's not IT in the business, folks. It's only the business. And we're a part of the business. We are a part of how we deliver care to our patients, how we serve our community.
Huge. I mean, and the cultures and the operations that like I see doing this best are exactly what you like set up how you're saying, where IT is and digital teams are understanding the vision that these folks have and putting their hand on their back and saying, we got you, like we're going to help you do this. And then they're handling the stuff behind the scenes, and then, letting those different folks throughout the organization kind of guide with their specialty, right? Because that's what they do is pharmacy. That's what they do is surgery. So like, obviously we wanted to embody what they're trying to do. And it's like, we can't have shadow IT, right? We got to set up the bumpers such that, they're within the acceptable range of variability. And it's also about education too, right? Like, for example, like we're talking about AI, right? Like a lot of the times there's AI tools that these vendors will advertise to RevCycle. They'll advertise to HR. They'll advertise to Access. And when in fact there was actually or is a tool that would suffice to meet the needs and solve for the use cases that all three of those teams have. But if I'm not taking the time to hear them out and understand what those use cases are, and then educate them on either the platforms that we already have procured and can do that, or looking at solutions that would suffice for all three of those goals and including them in what we're trying to do, then I'm missing the mark. Right.
That's exactly right. Yeah, that's exactly right. I mean, there are probably 2 or 3 things I've been saying to my team here, and certainly the teams from prior, right? Especially in healthcare. We stand behind, we're right behind every nurse, every provider, every rad tech, every EVS worker. We're not patient facing, but we're right behind those who are, right? We have to recognize our role in the organization. Another thing too is what we'll say to our customer is, don't engineer the solution. That's okay. Just again, come and talk to us about what are the opportunities. How can we help you? How can we understand that better? But again, that comes to still understanding what our role is in the organization. I don't pretend that I know what a nurse does or what a surge tech does, but I know what I bring to that and what the team brings to that. So we have those conversations. We know again what we can do in the organization. I mean, it's all those things. Again, it's dense, and I don't see it. It's not a challenge here. It's such a tremendous opportunity. And in the year that I've been here, I've been talking a lot to my team how we approach this. Now, at first, they were a little bit resistant because it was just like, well, that's just not how we UT Medical works. And I said, I hear you. We're going to get there together. I'm not imposing a bunch of things on you. We'll get there together. But I promise you that I do believe the organization will be accepting of this change. That we are and another thing I'll just say is that we're bringing these solutions or these opportunities, because I'll say one last thing in that vein is when our customer brings us a problem and we can't help or we don't help or whatever it is, the problem doesn't go away. Now they go back to their department and they have to solve the problem. And they do it in the best way that they can. No one, I've met no one in 30 years of doing this that has said, you know what, I know there's an IT department, screw them. I don't care if they can help me or not. I'm going to do my own stuff. Typically, they're like, I just haven't, not in my experience. When they've done it, it's because of absolute need. They still have the damn problem, and their department that hopefully was going to be able to help them for whatever reason couldn't financially, just didn't have the time, the resources, even if they wanted to help, and they had to go problem solve. And there we end up with shadow IT, right? Because they still have the same problem. So I said, just because we say no or we can't right now doesn't make the problem go away.
100%. And I mean, you talked about the promise of AI, the minutes, if you will, and like, well, and first and foremost, like I love your passion for like the mission behind what we're doing in healthcare, because I identify with that. That's why I got involved in healthcare. If I can play a small role in affecting a patient's access to care, the experience they have, like that's exciting to me. Like that's like something worth doing.
Mhm.
And it's something that my expertise can lend itself to. So,
Yeah.
but then to take it a step further with like the promise of AI and really the downright necessity of it, right? Like if you
Oh,
look
yes.
at
Oh, yeah.
in these
Mhm.
CEO summits I go to every year, and they show you like the future of healthcare in the United States, it is not bright. Like to be like ultra candid, like, yeah, like all these baby boomers retiring, you have
Mhm.
kids not applying to med school like they used to, like you have our population increasing, like there's all these factors that like
Oh,
we have to do something like now, like sooner rather than later to help with that. And I think AI, I mean, there's a lot, there's so much potential, right? Uh,
there really is. You know, when I think about this too, and AI is one of the most interesting, or AI technologies. Again, we all have heard, right? It wasn't just invented. It's been around for a
right.
long time. Right. In 2024, we sort of had the hype year of AI, and we're hearing about ChatGPT. Last year, everybody sort of exhaled. Okay, what can we really do with this? And where is the ROI? And let's start thinking about some real practical use cases. So it was like a real exciting year, and now we're going into 26. And so we look at that. So, I look at that technology, but I'm not gonna, again, I'm not gonna, I'm gonna be very transparent. When I started hearing about it, I'm like, what the flip are we talking about? Like, what is this? It was one of the most recent technologies that I could think of where our consumers, our customers, our patients knew more about it than IT, right? That wasn't a great feeling, because you could say, well, what about cloud? Yeah, but our customers not saying, can we do cloud? But they are saying, can we do AI? And I'm like, oh shit. Like we're on our back heels now in IT. When I started breaking it down and doing some education myself, I was like, you know what? These are really opportunities to deal with data, big data. We've been looking at our data challenges here at UT Medical. I had a little bit of an epiphany myself. I said, why is this a problem now? I'm like, oh, I know why. Because about 30 years ago, about 3 decades ago, we started digitizing everything, right? So we're using computers. People had computers at their desks, in their offices. So we have been churning out data for 30 years. And now we're like, oh my God, we have all this data. What is it? Where is it? All that. But we wouldn't have come to that until like relatively now, right? To realize it, like we've hit a tipping point. And then you layer on AI technologies that requires clean, contextual, abundant data. And now you're like, oh my gosh, I'm over here building my dream house here, and it's on a faulty foundation. Now it's an imperative that we understand
Right.
our data. But the reason that I say that I think AI is just holds so much promise for healthcare is because we have all that data on an individual patient, on a population of patients, on a disease, on an outcome. So now it's like, well, man, if we can just grind through all that data using human intelligence and artificial intelligence, we might find the needle in a stack of needles that changes the outcome for that patient or
Mhm.
that population of patients. Can it be applied in other industries? Of course it can. I'm not saying AI is only going to help healthcare, but because those minutes do matter, we have to get to that fast. It's like it's so ripe for that to say we have a big data problem in healthcare. And what can help with a big data problem? AI. Let's let the artificial brains run through 700 million patient records to find a like patient for the one that just presented in our ED. And now we can figure out how to help that patient much faster than if a human, right, was going to do that. Simple, but impactful.
Well, and I think for me too, it's about like one of the reasons I think we saw because I was when I was over in the UK,
Mhm.
they presented on because they're just getting into the ambient listening, like they're
Oh, yeah.
as opposed to here, where last year and the year before it like spread like wildfire. It was like,
Mhm.
one doc used it and he's like, "This is fucking awesome," and then like it was just
Yep.
like everybody wanted it. And in my experience, like part of that was just like it was a simple use case. It was like, okay, we're gonna listen to your conversation. We're gonna transcribe it. We're gonna summarize it. You're gonna have a look, see if it embodies what you talked about, and then you're gonna click a button. It's gonna upload it to the EHR. You don't have
Mhm.
to do it later.
Right.
Like, all right, that makes sense. And
Yeah.
then it did that, and then it was great. The point is that like it wasn't just AI, out in the ether. It was like this is the
Right.
use case. This is how we're gonna deliver it and then execute. And
Mhm.
so I think as I've as we've gone, what we've done more of too is like let's break it down by use case. Like let's isolate the use cases that are going to have the highest impact, that are going to save the most minutes, that are going to
Mhm.
have the highest ROI, or let us do more with less. And then let's walk everyone through to make sure everybody's clear on what we're trying to do here.
Right.
And and also, right, understand what those use cases are for the different groups. So again, when we're talking about like selecting partners or platforms or vendors that are going to support us on this journey, that we're not ending up with like, 20 different point solutions that we have to manage, AI,
Right.
when, that's just going to lead to more headaches than anything else.
Right, more complexity, more cost, all those kinds of things. We recently put together, well, when I came in, I put an AI task force together here, kind of a multidisciplinary group, and we developed what we call our AI guiding principles. Again, they're not
Love that.
chiseled in stone. I didn't bring them down from the mountain. They're on an electronic document that we can update as we need to. But I think the second bullet on that and the guiding principle is you must have a use case, and how are you going to prove that that use case, that technology is actually, what's the evidence?
Right.
And it can't be patient safety, whatever patient, what specific, how will we know that that's doing what we intend for it to do? And that's not because we're trying to be difficult. It's because we're trying to say, think through this. Again, what is the specific use case? What can we do here? And how will we know it's working? Because as much as we want these technologies to be beneficial, there is the pesky business of healthcare, right? It has to make sense. It has to be cost effective. It has to be beneficial. And that's sometimes the nasty part that we don't like to talk about in healthcare. Of course, we have this laudable mission, caring for patients. We're not going to be able to do that if we don't have money, right? So we've been just very intentional about that. But that guiding principles and that work task force has really helped us to be, again, very intentional. But it's not AI for the sake of AI. We don't have the time or money for that. It has to actually make sense for us. And we're in with ambient documentation too, and it has really changed things for our providers and our patients.
Yeah. No, 100%. Maria, this has been awesome. I appreciate you so much doing this.
Me too.
Last question I always like to end on is just if you could go back 10, 15, 20 years in time, what advice would you give your younger self?
So you're going to hear my response. You're like, you are the most egotistical person I've ever had on this call, and you've had my husband. So, um, he'd appreciate that. You know what? I wouldn't change a thing. I wouldn't tell my former self a thing, and here's why. It's not ego. There's been a lot of, a lot of highs, a lot of lows, a lot of in-betweens, but all of that has led me to who I am and what I do today. I wouldn't change it. I mean, it's not been easy, not by a long shot, and there've been obstacles, but I've worked through them and that. So I don't know. I think I would tell my, 30-year ago Maria, self at that time, nothing different. Nothing different. Just go through it. And it's not again, not, and I hope it doesn't sound like I'm egotistical, like I figured it all
No.
out. It's just that I wouldn't change a thing. I wouldn't change a thing. We're a product of our experiences, of our upbringing, of our everything. And I'm sort of okay. I got things to learn, but I'm okay with who I am right now. And that's how I got here. So I would tell her nothing. I'd let her experience it all just as I did.
Love that. I mean, that's the first time I've ever got that answer to that question. And I really, I think, I mean, maybe, I mean, it's been like 120 episodes now, but like, I love it. I mean, because I feel the same way. Like, I might tell myself to like buy Amazon or like, like
Maybe
something
that.
like
Buy
that.
Apple stock. That's a
But other than that, like,
Yep.
I'm more Fati, like love of one's fate. Like, I think that I love who I am in this moment. And to your point, it's the culmination. And like
Of
earlier
all
in my days, like, you get that feeling like, oh, I wish I was further along. It's like, no, it's like I'm exactly where I'm meant to be, you know?
That's the right thing too, right. We're exactly where we are meant to be at this time, forming these relationships, doing these things. I'm very much a believer of that too.
Brad, thank you again so much.
Thank you, David. It's been a lot of fun.
Absolutely. To our listeners, thank you all for tuning in. We will catch you all next week.